Yeah, well, I think other systems can teach us a huge amount. If we're thinking about how we got to the point that we are now, then let's compare the UK to other countries on the eve of the COVID-19 pandemic. And what do we see? Well, compared to countries like Norway, we have less doctors and less nurses. Compared to countries like Germany, as David says, we have less money per head, but we also have less beds. And actually the pernicious part of that is not just that we have less beds, it's that we have higher occupancy in hospitals. So they have less space, less capacity to manage surges in demand. And so when things like pandemics happen, or when things like seasonal winter viruses happen, in years like this year, then it's much, much more difficult. So there is that kind of core point of, do we have enough capacity? Do other countries have more capacity? And that's probably yes. The other big difference between the UK system and other countries, or many other countries that are comparable, is what we did in response to the 2008 financial crash. And we can't ignore that other health vital public services were cut from 2010 onwards. Those are things that are vital to healthy lives.
Yeah, but just very quickly, Chris, taking Debbie's point about the German system, came into being, I think, 1880. It's much older than ours. Doesn't seem to have the sort of problems that we've been talking about. In fact, that's exactly the point she made. Ours is only 75 years old. It's universal, but it seems plagued with problems. Isn't Simon right that actually there's something intrinsically problematic? I
don't think it's intrinsic. I think there are demonstrable points from quite recent memory where the NHS has worked pretty well. Let's look at 2007, to give an example. Public satisfaction was high. Staffing numbers were pretty good. It was a better state of affairs. I think what's happened is less that the NHS is different. It's that we have 21st century health needs and a 20th century model. So that's the catch up. It's not necessarily that there's something intrinsic in it being universal and free.